Hello, everyone, and welcome to today's session on resistance training. Whether you're new to resistance training or looking to refine your routine, this session will provide you with valuable insights. We'll cover the following topics: what resistance training is and why it's essential for your health, the key benefits of resistance training for your body and health, how to safely and effectively incorporate resistance training into your routine. By the end of this session, you'll have the tools you need to confidently engage in resistance training and take control of your health. Let's start with the basics. What exactly is resistance training, also known as strength training or weight training? Resistance training is a form of exercise that involves working against a force to build muscle strength, endurance, and tone. This force can come from various sources, including dumbbells or barbells, resistance bands, weight machines, your own body weight with exercise such as push-ups and squats, household items such as water bottles or canned goods. Unlike aerobic exercise like walking or running, which primarily work the heart and lungs, resistance training focuses on building and maintaining muscle mass, which plays a critical role in overall health. For individuals participating in cardiac rehabilitation, resistance training is a critical component of recovery and long-term heart health. Research has shown that incorporating resistance training along with aerobic exercise provides additional benefits for heart function, endurance, and overall quality of life. The first benefit we're going to discuss is the improved heart function and efficiency. After a cardiac event, the heart needs to work more efficiently to pump blood throughout the body. Resistance training helps strengthen the muscles, reducing the overall workload on the heart. This means your heart doesn't have to work as hard to perform daily activities such as walking, climbing stairs, or carrying groceries. Studies show that moderate intensity resistance training can improve cardiac output, reduce your resting heart rate, and enhance oxygen uptake, also known as VO2 max, which is a key measure of heart efficiency. Over time, resistance training lowers the strain on your heart, making it easier to engage in activities without feeling fatigued or short of breath. Resistance training can also lead to blood pressure and circulation improvement. High blood pressure, also known as hypertension, is a major risk factor for heart disease. Resistance training can lower the blood pressure by improving vascular function and reducing stiffness in the arteries. It also increases nitric oxide production, which helps the blood vessels relax and widen, leading to improved circulation and lower blood pressure. Better circulation means more oxygen and nutrients delivered to your heart, muscles, and organs, reducing the risk of cardiac events in the future. One of the biggest concerns for many cardiac rehab patients is regaining independence and confidence in daily activities. Resistance training helps restore the strength and mobility in your muscles and joints, making everyday tasks easier. It leads to better bone health by reducing the risk of osteoporosis by increasing bone density. It also increases muscle strength and endurance, which can help you perform daily activities with ease, such as carrying groceries or climbing stairs. And it can also improve your balance and coordination, which lower the risk of falls and injuries. Resistance training can also boost your metabolism. Muscle tissue burns more calories at rest than fat tissue, aiding in weight management. That can also lead to lowering your LDL, which is your bad cholesterol, and increasing HDL, which is the good cholesterol. Lastly, many cardiac rehab patients also have conditions like diabetes or metabolic syndrome. Resistance training plays a crucial role in regulating blood sugar levels and improving insulin sensitivity. It increases muscle mass, which improves glucose uptake and reduces insulin resistance. More stable blood sugar level means reducing the risk of diabetes complications and lowering cardiovascular disease risk. Incorporating resistance training into your lifestyle is one of the best things you can do for your long-term health. Did you know that as we age, we naturally lose muscle mass if we don't actively work to maintain it? This process is called sarcopenia. In fact, adults who do not perform regular resistance training lose up to 5 pounds of muscles per decade before the age of 50. After 50, muscle loss can accelerate to 10 pounds per decade. This can lead to a decline in strength, mobility issues, and an increased risk of falls and fractures. However, resistance training can counteract this process and provide many benefits that we previously discussed. As we say, if you don't use it, you'll lose it. So we must make sure that we are doing resistance training so that we can continue to use our muscles and maintain the strength and the muscle function. To maximize the benefits of resistance training while minimizing the risk of injury, it's important to follow key guidelines. This include warm-up and cool-down, which prepares your body for exercise and prevents injuries. Equipment selection, choosing the right resistance tools for your fitness level. Exercise selection, targeting all major muscle groups for a balanced strength workout. Routine structure, understanding reps, sets, and scheduling your workouts appropriately. Let's go through each of this in detail. Let's start with the warm-up. Think of your bodies as a car on a cold winter morning. We usually start our cars and let them warm up for a few minutes before driving to ensure that the car is ready to drive. If we don't let it warm up, we can cause damage to the engine, which can cost us a lot of money to fix it. Similarly, we need to give our bodies a few minutes to warm up before resistance training session as well. A warm-up is essential for preventing injuries and improving performance. A good warm-up should last at least 3 to 5 minutes. Be at an RPE of 11, meaning it feels fairly light. You should not tire yourself out during the warm-up. The goal of the warm-up is to increase blood flow to the muscles and the joints. Some examples of warm-up activities include marching in place, arm circles, and shoulder rolls to make sure that the full body is ready to go. Similarly, a cool down at the end of your workout session allows your heart rate to return to normal, reduces muscle stiffness, and prevents blood pooling in the leg, which can cause dizziness. This can include light stretching or deep breathing exercises. Spend at least 3 to 5 minutes to cool down at the end of your resistance training session. Next is equipment. You don't need a gym to perform resistance training. You can use a variety of equipment including resistance bands, which are great for beginners and are also travel friendly, dumbbells, which are versatile and effective for building strength, bodyweight exercises such as squats, push-ups, and planks, which require no equipment, household items such as water bottles, canned goods, or heavy books, which can be used as weights. And lastly, if you do have a gym membership, you can use the machines, which are great for beginners as they provide controlled movements. When choosing a weight for resistance training, we want to make sure that you choose a weight that allows you to complete 8 to 10 repetitions at an RPE of 15 or hard effort. As you get stronger, you can gradually increase the resistance. If you're easily able to perform more than 10 repetitions, the weight may be too light. And if you struggle to complete 8 to 10 repetitions, the weight might be too heavy at this stage. Let's move on to exercises. A balanced routine should target all major. Lastly, let's discuss a routine. When performing resistance training, we should aim for at least 2 days per week up to maximum 4 days a week, allowing rest days in between sessions. We do not want to complete resistance training every day as our muscles and joints need more time to rest and recover. We should aim for at least 1 day of rest in between 2 sessions. You can also choose a variety of equipment and different type of exercises as discussed earlier to keep it engaging. You can find detailed resistance training packages or videos on our website for guided workouts, or you can also attend live events which are led by one of our exercise therapists to complete your resistance training session. To ensure a safe and effective workout, always remember that your resistance training sessions should be pain-free and symptom-free. If you experience any discomfort, please modify the exercise or consult an exercise therapist. Maintain proper technique. Poor technique can lead to injury. If you're unsure on how to perform an exercise, please attend one of our live sessions where the exercise therapist will guide you on how to perform an exercise correctly. Breathing correctly. Ensure that you are breathing throughout your exercise session. Do not hold your breath when performing the resistance training exercises. A general rule of thumb is to exhale on the hard part of the exercise and inhale on the easy. Advanced exercises. Before you do any advanced exercises, please get clearance from either your family physician or consult one of our exercise therapists. And lastly, if you have conditions such as hernia or glaucoma, please inform your therapist to review precautions, or again, please speak with your family doctor before participating in resistance training sessions. Let's test our knowledge. Which of the following statements is incorrect? Resistance training should feel hard or have an RPE of 15. Completing regular resistance training can reduce your LDL cholesterol levels. Resistance training should be completed 2 to 4 days per week. A warm-up is not necessary prior to resistance training. Completing regular resistance training can reduce your blood pressure. The incorrect statement is D. A warm-up is not necessary prior to resistance training. This statement is incorrect because remember, no matter what exercise that you are doing, we should always perform warm-up as it prepares your body and reduces the risk of injury. So always perform a warm-up prior to an exercise session. Before wrapping up, take a moment to reflect on your own resistance training routine or any goals that you might be working on. Are you working towards a goal? If not, maybe it's time that you think about a goal. Reflect on your goal. What went well? What can you do differently? And how can we support you in your goals? For additional support, resources, and live training sessions, please visit our website.